It's my pleasure to kick off this year's award of the Christian International Health Champion Award. The CCIH Christian International Health Champion Award recognizes an individual who has dedicated his or her life to global health from a Christian perspective and made significant contributions to the field and to the development of CCIH. This award has been around since 2014, and last year's recipient is Frank Baer. And Frank is going to take it from here, tell you more about the award and what it's meant for him, and also introduce Robin. So please, come on up.
So he gave me 3 objectives in 3 minutes, and I don't have time for any of those first 2 objectives. 6 years before Alma Ata, can you count back? 1972, there was a group of administrators and nursing instructors that got together at Emory University School of Nursing and created a group called INSA, the International Nursing Services Association. And the goal of INSA was to contribute to healthier communities around the world, but with a particular focus on health education and management training. Very interesting choice of areas to focus on, but one that ended up being very important for them. In 1985, Robin Davis became the executive director of INSA and led that organization for the next 3 decades. She shaped the work of INSA, expanded it to include community health worker training, or training of trainers of trainers of trainers of community health workers, goat husbandry in Haiti, and management and leader training for participants from Africa to China. In fact, I learned to know INSA as a management training specialist. She also helped evolve the organization to change its name to become what you know today as Global Health Action. She served with INSA Global Health Action for 30 years, retired from that position in 2015, and that's when she turned things over to Wendy Jolly-Capi, who took over as president and CEO of Global Health Action. Now, the other story that interests us is that during the 1980s, Robin attended the National Council of International Health, NCIH. They used to have an annual conference in Washington, D.C., and she began meeting with a group of Christians informally during that conference. The first of those meetings was in 1988, where a group met at a meeting room at the Omnishore Hotel. And then over the years, since then, she participated in that group and encouraged them eventually to take a leap of faith to become a formal organization. At that time, this informal group became affectionately known as the Christian Conference of International Health, because it was linked so closely with the National Conference of International Health. It became known as CCIH, the Christian Conference of International Health. Well, when CCIH decided to become CCIH, the only thing we had to do was change conference to another name. And that's where we already had the acronym. We just needed to find the connections to become Christian Connections for International Health. But what was important at this point was that most of us that were participating in that group were not specialists in managing NGOs. You know, we were health providers or we were project managers, but we didn't know much about managing NGOs. And that's where Robin's know-how in organizational structure, in working with INSA and Global Health Action became so important for the development of CCIH. And it was in that role that Robin served as the president of the board for CCIH from 1992 to 1996. Robin, please come up. Oh, here it is. And over here. So, Robin, on behalf of a very grateful CCIH, we thank you for your contributions to global health from a Christian perspective and reward you with being the 2018 Christian International Health Champion for CCIH. Congratulations. The podium is yours.
Thank you, Frank, so much. Appreciate it. We worked together for a number of years on that conference for CCIH and then the development of the organization. I'm very honored and humbled to receive this award, the 2018 Christian International Health Champion Award, from the CCIH board and staff. I thank you very much. And I thank Wendy Jolly-Cobb of Global Health Action for the nomination. My life and my work in international health are blessed, and they're enriched by the many friends, colleagues, and partners that have developed through CCIH and Global Health Action over the years. It's a true blessing when you feel that your life's purpose, your faith, and your work all intersect. And I've been blessed in that way. Being involved in international health for more than 42 years has given me the opportunity to see many things. And it's given me the opportunity to see vital and transformative work that we have all accomplished together, and the opportunities that are there for more of this transformative work when it's based on the common Christian values that we share of love and compassion, dignity and respect, integrity and trust. The power of connections and partnerships can translate into strong and lasting programs. Frank had mentioned some of these that we had started through Global Health Action. In 1980, at the National Council for International Health here in Washington, D.C., a mutual colleague introduced me to an Episcopal priest from Haiti. And this Episcopal priest had come to NCIH wanting to meet us to talk about training community health workers for Haiti. He was the president at the time of the Pastors Association, representing 40 mountain communities in rural Haiti. At the same time that he was requesting this of us, the government of Haiti had spent years deliberating and planning to develop a community health worker program, but it hadn't yet come to fruition. So these church leaders in these rural communities took action and responsibility themselves, both at the community and at the district level. They requested that we come to Haiti and meet with a listening group about this situation. And their request basically was, we don't want you to send doctors and nurses to Haiti to treat us. We want you to train us and our community leaders as community health workers. And they said the reason for this is, as church leaders, pastors and lay leaders in the churches in these rural communities, we're the best educated and we're the most trusted people in our communities. And mothers are bringing their sick and dying children to us, asking us to help save their lives and make them well again. So they just said, we need the knowledge and the skills. We need to be equipped to do this. And with that, the program, from these connections and these shared purposes, became a reality. The faith leaders made this happen. So this is part of the power of the types of connections that we can all develop through our work. And to illustrate this, I'd like to share one of the examples. At his graduation, one of the lay pastors who was trained as a community health worker, he got up and he shared with tears in his eyes. He said, if I had known this information 3 years ago, I could have saved the lives of 2 of my own children. These were young children that died from dehydration, from diarrhea, completely preventable. So this is the power of the work that we can all share. Back to this Episcopal priest. I had the opportunity to ride with him through many parts of Haiti. And one day we were in his Jeep and off we went up this treacherous mountain road. And you all been there and seen these. They're not 2 lanes, they're like 1.5 lanes wide, and you don't know what's coming around the next corner. No guardrails any step of the way so far. So I leaned over and I asked him, I said, is it like this? Is it this treacherous the rest of the way? And he turned to me calmly and he said, don't worry, Robins. We go on God's business. That's faith in action. In her session yesterday, Dr. Golden spoke from USAID, spoke about our strategic advantages as faith-based organizations and people of faith. In my experience, one of the areas that she mentioned is so critical, and that's trust. Trust is so important. Our strong partnerships that we've been talking about throughout this conference are truly based on those one-on-one, person-to-person relationships that we develop. Global Health Action has been working in China since 2001. During that time, we have forged very strong partnerships at the national and the provincial level, both with top government officials and also NGO and faith-based groups as well. To illustrate the importance of trust from a global perspective, let me just share this one incident. The top Chinese official that was leading our programmatic efforts as the director of a major department, this particular official was quizzed at a high-level government meeting by other government officials who asked this official, they said, why are you partnering with Global Health Action and with Robin? This is a group that's private, nonprofit, has Christian values, faith-based orientations. And this official's reply was, because I trust them, because they keep their word, and because they are based on Christian values. And this came from somebody who's a non-Christian, but that was very important to her. Our work within the church can also be very transformative within our own ranks. Some years ago, in a workshop in China, we were asked by the Amity Foundation, one of the large Christian umbrella organizations in China, to come and work with them and lead a workshop on community-based HIV/AIDS training for leaders who were interested in prevention and treatment at the community-based level. This program represented participants from the China Christian Council, from CDC, China CDC, from the Women's Federation, from many, many groups, both governmental and private organizations. During this time, each representative, they came from 14 different provinces, got up and introduced themselves. One woman got up and introduced herself and talked about their work with commercial sex workers and treating and educating these commercial sex workers to prevent AIDS, HIV and AIDS, and to increase their awareness and to improve their health. When it was time for another participant to stand up, he represented the Christian Council in China, was very top official. And he stood up and he introduced himself, and then he said, we should not be working with those women. He said, those commercial sex workers, they're sinners, and we should not be working with them. We should have our priorities elsewhere. The group, listened to what he had to say. Everyone continued to share. The process of sharing and building small group relationships continued over the next day and a half. And then the third day in the morning, first thing, he raised his hand and he said, I'd like to share something. He said, through the testimonials and the experience of my fellow participants, I apologize to you for what I said about the commercial sex workers. He said, they are sisters in Christ, and they are people that are part of our fellowship, and their health is important to all of us. That was a transformative moment, and I think we all have the power to be part of that. So CCIH's role over the years has grown and developed, and it's more vital today than ever. So I encourage you to form new and lasting partnerships through this group around the world. And when the road ahead gets treacherous, and there are no guardrails, and there's unforeseen blockades, remember, don't worry, and have faith. We go on God's business. Thank you.